I'm Linda Havlin. I work in Mercer's health and benefits business, where I head up our research and intellectual capital capabilities. Healthcare reform has emerged as a major political, social, and economic issue for the United States for several reasons. More than ever, in 2009, we're confronting the sheer cost of healthcare. It's made us uncompetitive at a global level. It's very hard for organizations to afford health coverage. We're seeing an incredible number of employers, particularly small employers, drop coverage altogether, to the point that now 35% of employers no longer provide health coverage. So something has to be done from a cost standpoint. And second, we have so many people now, close to 20% of our population, who are uninsured. That's a social embarrassment to us as a country, and the problem's been exacerbated because of the recession. As you know, so many people lost jobs, and when they went to the individual insurance market to find coverage, they met the usual barriers that have been in place for such a long time. There were pre-existing condition exclusions, or they weren't allowed to enroll for various medical history reasons. And the cost was, in some cases, just totally unaffordable when there's no subsidy from an employer or from the government. And I think the third reason why I'd say it's the right time for health reform to come about is that we have a growing recognition of the quality problems in our healthcare delivery system. We have very uneven levels of quality driven by inconsistent medical practices, as well as noncompliance from patients. We don't always do what the doctor asks us to do. We don't always lead the healthiest lifestyles, and yet we expect somebody will make it all perfect at the end of the day. The problem of healthcare cost and quality is not unique to the United States. This is a problem that countries are experiencing, no matter what their form of health coverage would be, whether it's socially provided through the government or whether it's a private program. And what we see is a constant struggle to try to find the right value equation. How much money do you have to spend, and what can you do to deliver what's needed by the population? Passing health reform in the U.S. is going to be a considerable challenge. We know from history that this is a very difficult subject for Americans. First of all, let's think about the size of our economy that participates some way with health care, either providing care, providing supplies and medications or equipment, supporting it from an insurance industry perspective. So we have so many stakeholders who are involved day to day in the provision and basic maintenance of healthcare is a substantial part of our economy. So we have a lot of people with vested interest who are really concerned about what happens here in the outcome. Looking back to the 1930s, when we had our first foray into health reform, I've only noticed that there was one truly successful initiative, and that was in the 1960s with Lyndon Johnson's Great Society programs. He was able to pass Medicare and Medicaid based on having a very simple message about the need to address the problems experienced by the aged and the poor. There was a compelling case for it. He aligned all the stakeholders and really worked the political process in Washington to make it happen. And so the lesson that we learned from that is that presidents really need to set a high-level objective for why we need reform, what's the case for it, what's the outcome going to look like, so we know what we're aspiring to. And what's different about right now is that we have a president who's gotten behind this issue as one of the most critical issues for his administration. President Obama very early on stated very clearly what his objectives would be for health reform. And they were a rallying point for many people because they clearly stated an idea of taking us to a better place. It was an aspirational message. It wasn't overly complicated. He wasn't getting into the details of reform at all. But he laid out a challenge to Congress and the stakeholders to make it happen. This is a critical time for all the stakeholders to come together and agree on what's really important. And I would tell you from the employer's perspective, the things that are most important are to build on the strengths of the system that they've supported now for decades. They've been a forefront for innovation, for getting employees to be more aware of their healthcare risks and lifestyle issues. They've really engaged employees in participating in care management programs. And right now, they're very focused on getting employees to do the right things, take their medications, follow the doctor's orders. These sound like simple things, but these were many of the things that have led to high and unnecessary costs in our system because of non-compliance. They also want to make sure that physicians get incentives for complying with evidence-based guidelines and standards of care. They want to see physicians rewarded for doing the right things and centering their practices around the patient's needs, making sure that patients are fully informed and feeling comfortable and knowledgeable about the course of treatment that they're getting. So these are important strengths to keep. Another important strength is the ERISA system, which ensures that employers can have a consistent benefit program in every state where they operate, and that they don't have to abide by myriad and conflicting state mandates, which would mean unique benefit programs every place they operate. So the flexibility and control of the benefits that they provide are really essential to them. They also want to make sure that individuals are required to have insurance, because if we've gone through all of this reform and at the end of the day individuals are not required to have insurance or take advantage of government subsidies if they become available, then we haven't corrected our uninsured problem. So I think employers want to make sure that we've really taken the best of the innovations that we've created, solved for the uninsured, and have a long view on the need for continuous quality and cost efficiency improvement.